Our body has different types of qi. Qi as a universal energy that connects all living beings, but also there are different types of qi internally in our body.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
You know, Hadar, I've been feeling good, feeling a bit traditional,
Yes,
feeling a little bit like non-conventional. What do you say?
I say let's go for it. As you know,
The Learn Skin way, my friend, isn't it?
Yes, we definitely all about integrative medicine, and part of it is Western medicine and part of it is traditional medicine from various traditions. Of course, one of the most famous one is traditional Chinese medicine. And today we have with us a guest who learned how to merge everything together. And we want to talk about the impact of traditional Chinese medicine on the skin, but actually how you can combine both gut health and respiratory health. We haven't spoken about that, I don't think, ever on this program, something that doesn't always come up when it comes to skin health. So let's dive into it, shall we?
I love it. And, you know, we probably should talk more about respiratory health because we know the atopic triad has respiratory in there as one of the triad, right? So
absolutely.
Pretty interesting. So we have Oksana Gryvnak, and she is an acupuncturist, but she's also got a background in nursing from the Ukraine. And she is coming to us all the way from Toronto, which we love. We love interviewing international, so this is pretty cool. And she's working at the Wellness Acupuncture Clinic. And so, Oksana, we are super excited to talk traditional Chinese medicine with you. Welcome to the podcast.
Thank you, Hadar and Raja. I'm excited to be here today.
Hey, Oksana, you know, I'm really fascinated by your background because it's not a common thing for someone to start in Western medicine and then, you know, decide that to drop everything, years of training and experiences, and just move to a whole new way of thought. And I'm wondering if you can maybe tell our audience how you came about to that decision. I mean, I think, you know, even in the US, you can imagine that you moved from a pretty secure way of providing for yourself, right? You know, a nurse can go work in a hospital, in a clinic. It's pretty straightforward. There's insurance reimbursement. And then you go to traditional Chinese medicine, who for most part is self-pay kind of practice. So, but before we even get into that, what did you see in Chinese medicine that really got you intrigued?
That's a great question, actually. So my background in Western medicine is in nursing, and I used to work in the hospital in the cardiology department. And I've met a lot of people with different backgrounds, with different conditions, and still treated the same way. It doesn't agree with me in some way that everybody's treated the same way, logically, very protocol-based treatment. And I started looking around and reading a lot of books about more holistic approach and how a person should be treated holistically instead of just getting some treatments for the disease only. This is how I stumbled upon on Chinese medicine route, and I got acupuncture treatment and fell in love since then. I started reading a ton of books, looking for some training, and here I am 10 years later, after years of studying and still keeping up with a lot of new development, new studies coming up every year in regards of Chinese medicine. And I think it's one of those modalities that you can study all your life and never even scratch the surface.
Yeah, no, I think it's true in every field of medicine, let alone when you try to integrate a few areas of specialties, even within that, right? And I know you completed a training that's focused on TCM for skin health, right?
Yes, it's one of the areas that I'm specializing in after many patients bringing their children usually with skin conditions and me trying to treat their diseases. I started looking around for more specific training in Chinese medicine dermatology. And that's how I stumbled upon one of our very famous professionals in this area, Mazin Al-Kafaji, and I studied in New York under his program in dermatology.
I think a lot of people listening to us, and maybe even some Western trained physicians, nurses, other healthcare professionals, they all think to themselves, do I need to know Chinese or have any background in Chinese culture? How hard it is, how relevant it is to studying actually acupuncture. I know it sounds a little silly, but I was speaking to someone the other day and they were mentioning this kind of barrier. Is that a real barrier? Because to me, it doesn't seem like it, but how much of a barrier is that?
I think if you're truly interested in learning something, even Chinese language is not a barrier. But honestly speaking, the programs in Canada and in US right now are all in English. Lots of books, all the classic books dated 2000 years are all in English, all available. We are living in an amazing world where everything is accessible and we can study something that started thousands of years ago in English at your hands. Just all you need to do is study. Everything is available.
Now, this is amazing. And speaking of thousands of years, there's a lot of overlap between traditional Chinese medicine and, many other traditions such as Ayurvedic medicine. So maybe that leads into my next question is harmony and the way that harmony is viewed and homeostasis is viewed in these other traditions. So can you talk a little bit about how do you view the connections between, say, the gut and the skin? And I know we're going to talk a little bit about the breath, so that brings in respiratory well-being too. So how do those connections map together in TCM?
TCM views a human being as a combination of 5 elements. And one of the elements is metal. And metal has lungs, large intestine, as a paired organs of this element. And they are internally and externally connected. And one of their connection way is basically lymphatic system, or what TCM calls the Wei Qi, the system that is protecting our body. This Wei Qi connects large intestine and lungs, and it also spreads around the skin. And this is how Chinese viewed this element as a connection of lung organ, large intestine, and the skin.
And then when you take that approach, maybe we can take one step further and talk about how do the energies pass between, throughout the body? Because I know there's this concept of qi, whether it's digestive qi or if you're thinking about how the interconnections actually happen from a Chinese medicine standpoint, how do things flow from one organ to the other? Can you talk a little bit about that? Because I'm sure that gets into your holistic approach when you're looking at skin issues.
Oh, yeah, definitely. Our body has actually different types of qi. Qi as a universal energy that connects all living beings, but also there are different types of qi internally in our body. In terms of skin health, we have this Wei Qi that is protective. I usually, when talking to the patients, try to explain it more Western way of thinking, because in Chinese medicine we have a lot of metaphorical analogies and they are beautifully put, but sometimes really hard for people to digest. So how I usually explain this connection is through the lymphatic system. We have the large intestine that is surrounded with a lot of tiny lymph nodes. And if the gut, especially if the gut is permeable, if we have some issues in the gut lining, through the lymphatic nodules, the inflammation will be spread around. And this lymphatic system, it reaches every part of the body. And in a way, this is how skin will basically show what's happening in the gut. But also the lungs are involved into the processing of the oxygen and releasing. Same with large intestine. It's processing the food and it's releasing the waste. Both organs are taking what's the body needed the most and releases the waste.
That's very interesting that you're talking about the gut and digestion. Raja alluded to the digestive chi. And thank you by the way, for kind of explaining that. I think thinking about the lymphatics is a good way for some of us to make that connection. Although I know, as you mentioned, in Chinese medicine, there's a lot of beautiful analogies and metaphors that are used to describe these relationships. I think that one of the areas that's really coming to the fore, at least in Western medicine, is the whole concept of the microbiome, right? Both the skin microbiome, the gut microbiome, as the kind of two externalities, the gut being the outside on the inside of us and the skin, of course, on the outside. And so areas that really heavily colonized by the microbiome. I wonder if Chinese medicine accounts for that in any way. Does that concept of the microbiome exist in Chinese medicine? And of course, its relationship with our body, probably the most common with the immune system. But does that concept exist in TCM? And if so, how is it manifest?
Concept of the microbiome itself is not something described traditionally. In TCM, digestive system is considered a foundation of health. It's the center of our well-being. The most important system in the body because of absorption of nutrients. When our digestive system is functioning properly, then the nutrients are absorbed and the waste products eliminated. But when something is going out of balance in the system, like poor diet, stress, or there is stagnation of qi, then it can lead to issues like accumulation of what in Chinese medicine we call dampness or heat or damp heat. This is what translates basically to inflammation, inflammatory issues of the gut. What Chinese medicine observed that a lot of the herbs will help with digestion. Some of them will relieve the bloating. Some will just cool down the inflammation. And now we have a lot of studies confirming that those herbs are actually anti-inflammatory, antifungal, antibacterial. Some of them are having specific types of fiber that good bacteria feeds on, the probiotics. So all those herbs, especially the formulas for digestive health, are packed with nutrients and with everything that good bacteria needs to thrive on. And therefore, those formulas and those herbs are extremely important in developing this great gut health.
That's actually very interesting. I know that one of the important concepts in Chinese medicine is to restore that balance, right? So you have, excess and dampness, for example. I'm not going to make believe that I understand what I'm saying exactly, but there's excess, right? And then you use some sort of herbal combination to treat that, as you mentioned. But then there's the whole concept of maintaining, right? Of maintenance of the balance that now you've restored. And do you do that with herbs or is that just food? The concept of prebiotic, if you will, in Western medicine.
Mhm.
How do you maintain that after the initial restoration of the balance?
Mhm. In Chinese medicine, we always start with lifestyle and dietary suggestions. If that doesn't help, acupuncture comes next. If that is not enough, then the herbs come next. Herbs are more like an emergency care. Unfortunately, these days, when people get to see their TCM practitioners, they usually have issues that been accumulating over a long time. So herbs are usually necessary as an emergency treatment, and then we move on to just healthy lifestyle recommendations. The herbs are also never given just one at a time. We create formulas. We create a harmonious formulas always targeted to specific case and patient. And that always have a couple of stages. First stage would be to remove. It's mostly like the 5R gut protocol, but in TCM way. we remove the excess. We work with those dampness, damp heat to resolve it. Those formulas are usually very strong and are not prescribed for a long time, 3 weeks max. Then we move on to harmonious formulas. Those are intended to fix the microbiome, work with the gut lining. So people are transferred to more harmony. And after that, we have like a supportive formula just targeted for whatever symptoms and signs are left over. For example, if we were working with skin at the third stage, if people have some hyperpigmentation, we work with that. So it's more an exit formula that is a lot more softer, that has a lot of tonics and support the health and glowiness of the skin. And then we move on to just a healthy lifestyle and diet.
No, that's great. I'm wondering, just going back to the microbiome and trying to understand how that may be intertwined with your practice. Do you see a role, maybe you're doing it right now, but a role in the future for gut testing, for example? Would that be of relevance to the TCM practitioner to do these kind of more modern testing now that you can order and get all kinds of information about composition of the microbiome that exists in the gut? Would that be of benefit? Is that something that Chinese medicine practitioners would value?
I think we are entering now the era when everything is integrating. And I think traditional Chinese medicine, as a part of alternative and holistic medicine, would probably benefit a lot with integrating some new technology, testing the blood work and the especially gut microbiome. Now we have a lot of studies confirming what herbs are improving what specific types of bacteria, or they are working with what pathogenic bacteria types. So if we will have a very clear list of what is going on in the gut, then it will be a lot more easier to figure out the formula for this patient, because we still are playing around with some herbs and experimenting. Yes, we are modifying every time when something is not working very well or if it's not that effective. But if we would have tests done and the results there, probably will improve the, I would say, the speed of work.
I really like the way you're thinking, Oksana, because it really excites me when practitioners are open to innovation and trying to, push the limits on their own field and discipline and welcoming other way of thinking. I think it's really where innovation happens and ultimately it benefits patients, right? I do want to make sure that we get to the idea of breath here because this is something that's really interesting. So when we discussed earlier, you mentioned the concept of balancing the breath and how there's a correlation between the lung health and skin condition, and that's all viewed through TCM. So maybe you can start by telling us, why is breathing the right way, whatever that means, is so important in TCM? Is there a right way of breathing?
Most people right now are stressed out, and there is a lot of issue going on with the respiratory health. With TCM, it emphasizes the importance of balancing the breath. It harmonizes the respiratory system because it governs the circulating of qi through the body. When we are breathing deeply, involving the diaphragm, this ensures the smooth flow of qi and it disperses the body fluids. When lungs are functioning well and opening up completely, and respiration happens with diaphragmatic breathing, it helps to maintain the skin by regulating the sweat and body fluids. We also see the correlation of some dermatology diseases and the outbreaks with serious stress. The breathing itself will, especially diaphragm, will work on the vagus nerve and stimulate it, therefore lowering the cortisol level and helping with release of stress. That always helps with the skin conditions, especially the ones triggered with stress.
Is there a routine breath work that you prescribe to your patients?
I usually start with a very easy box breathing, for example. So people learn to breathe in, hold, and breathe out, hold at the same level. For example, we start with 4 times 4 box breathing. So they have to inhale for count on 4, then hold on count 4, then exhale 4, and hold for 4. That is very classic anti-anxiety and stress releasing breath. When they get used to it, we improve I usually ask them to hold on 6 and exhale on 8. This is really involving the diaphragm, and it also calms the mind. So with breathing, as long as people get a minute or two every couple of hours to relax and do the belly breathing with their diaphragm, it's already beneficial. And that's all I'm usually asking them for, just to start somewhere. And there are a ton of different techniques in Qigong that are helping to cool down the body or stimulate the body, have some movement going. But we start very simple breathing just to open up the chest and release the diaphragm.
That's very interesting. And I think usually these breath exercises are limited by a number of cycles, right? I don't want our listeners to do this now and try to walk around the house doing this for the next 30 minutes and then fainting. So I think there's usually a limit of how many cycles at a time as you get used to this, right?
Yeah, it's never over 2 minutes at the beginning. It's slow but steady progress. That's all we want. People tend to try, let's do it all, and trying to breathe for an hour in the morning. They will ask me, how about my meditation? I can meditate and then breathe for 15 minutes and then start my morning with hot water like Chinese medicine prescribes. But I always ask, slow but steady is the best, and it's the way of Chinese medicine. No extremes.
Yeah, I really like that. Can you maybe give our listeners an example of a common skin condition that you would recommend? I know you mentioned a lot of these conditions that are, provoked by stress. Where do you find yourself most commonly recommending breath work when it comes to skin conditions?
Lately, I've seen a lot of psoriasis and eczema, and both conditions very much triggered by stress. Every time when patients can come and we start talking about how they got it, it's always related to some kind of stress, even what they would describe as a positive stress and not taking it as stress, like wedding or moving. But what is induced by stress will always benefit from breathing exercises. So that's when we start with breathing, box breathing, and then we move to some more complex breathing protocols, but it's always targeted on one-to-one basis. It also very much, in many cases, dries out the lungs. Because of shallow breathing, there is lack of circulation, and people will feel some dryness, and their lymph nodes will be swollen, and they will feel some dry throat at all times. So we work with hydration at the same time as breathing, because lung tissue likes to be moist and hydrated. That's why dry air in our houses also is not recommended. So humidifiers helpful. And every time we talk about breathing, it's always good to have either moist air or access to fresh air somewhere outside at the nature site.
The concept of breathing is so fascinating because I think we talk so much about gut health, and the notion of respiratory health sometimes gets lost, but there definitely is a breath mind connection. And I think, the notion of in Ayurveda prana, which is like the energy of the breath, or I'm sure TCM there's an equivalent. But I think this notion of stress isn't just limited to eczema and psoriasis, Oksana. I can think of like a bunch of conditions where the stress is flared, alopecia areata, vitiligo. I think maybe just in general anxiety. So if there's a way that you can,
Mm-hmm.
instead of being so passive with anxiety, sometimes we can focus on pharmaceuticals, which are very helpful. I'm not trying to minimize them, but having an active way that you can take charge of managing your anxiety on your own can sometimes be empowering. So I think it's really incredible that, you're doing this sort of work with patients.
Yes, Raja, I'm totally with you on other conditions, especially alopecia. It's something that always triggered by severe stress. Anxiety is extremely common right now. Most people are anxious, even when they're mentally trying to take it easy. Physically, their body is extremely stressed out. This is what we call chi stagnation. When we check the pulse and we see there's a lot of tension, but people are still trying to deny the strength of it. They're like, oh, it's just regular stress, but their body is all stressed out. The breathing becomes extremely shallow in this position. And people, after discussing this, will start noticing that, yes, when I'm in the meeting, I stop breathing. They say they stop it because the tension is so obvious. They can't even notice how the breathing is still going, but it's extremely shallow. So breathing is something that very much now are important to implement in daily practices, or as I usually recommend my patients to have every couple hours a break, to have a minute or two to breathe, just to relax and stimulate the vagus nerve.
On that note, I hope all of us have stimulated a little bit of our vagus nerves and got into a better place over getting educated on this topic.
Yeah, absolutely. And I would urge everybody, first of all, if you're a practitioner, I know when I do a biopsy, I get my patients kind of to lay down, of course, but then also encourage them to take deep breaths and try to encourage them for what we call belly breathing. So even every simple procedure can do this more acutely. But then also for all of us, we should put a reminder on our phone every couple of hours to breathe. And with that, I want to thank Oksana for reminding us that not only the gut and skin and brain are connected, but our lungs are also part of the deal. And so as healthcare practitioners with focus on skin health, we should all be taking a deep breath and going for it every day. And I want to thank you, Oksana, and hope to see you soon.
Thank you, Hadar. Thank you, Raja. It was a pleasure.
We hope you enjoyed today's episode. It doesn't have to end here.
Not at all. In fact, at Learn Skin, we're continuing to develop new programs to help you stay up to date on the latest in the field. In fact, our newest program that recently launched is known as the Dermatology Clinical and Integrative Essentials, also known as the DCIE program.
That's right, Raja. Why don't you tell us more about the DCIE?
This program is designed for PAs and NPs who are starting fresh in the field of dermatology, or even if you have years of experience under your belt.
Well, that sounds pretty useful. So what does the DCIE cover?
Well, we've teamed up with dermatologists, PAs, NPs, and primary care colleagues to develop a comprehensive curriculum that covers the most common concerns seen in the dermatology clinic. But then we've also layered on what we do best at Learn Skin, which is integrative dermatology. So you're treating the patient from the inside out and the outside in from an evidence-based approach.
Holy moly, this sounds like a wealth of knowledge. So do you recommend new or seasoned clinicians to join?
Well, both. If you're new to practice, this is an excellent starting point from the nuts and bolts of dermatology. And for our veteran colleagues, you'll get up to speed on the latest emerging conventional therapeutics. And for both of you, you'll learn about the integrative approach, including topics such as nutrition, diet, botanicals and herbs, mind-body approaches, and more.
Wow, that's a lot. Can this be done online?
Yes, it can, because we're rolling with the times, Hadar. This can be done online and self-paced. But we also have directors who guide you along the way and host live virtual case discussions, guest speakers, and peer-to-peer mentorship sessions.
All right, my friend, this sounds like a very cool program. So for you listeners out there, if you want to enroll in the DCIE program soon, go to learnskin.com. And until then, stay curious,